Hello, everybody, and welcome to Ask the CEO with Avrohom. Today, I'd like to introduce a very special guest. He's the founder and CEO of PathPresenter, a company that provides a web-based service to connect pathologists, radiologists, clinicians, and life science researchers to share medical data and build tools for enhancing medical education, patient care, and management. As part of this discussion, we will share how their partnership with Microsoft, their use of Azure and the Azure Marketplace have empowered them to scale and grow their business. It's my pleasure to welcome World Health Organization advisor and professor at Icahn School of Medicine at Mount Sinai, Dr. Rajendra Singh. Welcome, Doctor.
Thank you very much, sir, and thank you very much for the opportunity. I'm very happy to talk to you about how PathPresenter and Microsoft are helping the clinicians around the world to help the physicians that they work with do a better job.
Yes, and I'm honored to have you on the show today.
Thank you very much.
Rajendra, we're currently in the midst of the global COVID-19 pandemic where hospitals and healthcare providers are struggling to care for an enormous amount of patients, let alone the influx of patients that flooded our healthcare system just over the last few weeks. There's so many tools out there, such as cloud and artificial intelligence, which can empower our physicians and healthcare workers to deliver better care. Yet it doesn't look like people are adopting them. What are the challenges physicians and healthcare providers face with regard to leveraging existing technologies to deliver better and more efficient patient care?
This is a very apt question given the current situation, because we are hearing about COVID-19, putting brakes to the entire world actually. So why are we struggling like this is because we don't have an effective treatment for the disease. The vaccines will still take at least a year to come basically. And the reason we do not have an effective treatment is because we do not understand the underlying pathophysiology, like what is the virus causing in the body, how is it damaging the lungs, why is it causing so much damage that we save these patients that are very close and dear to us actually. And the reason is because this is almost like a new disease. The virus keeps changing every year, and the virus, the way it affects the body is very different. And unless we understand the pathophysiology, what is it doing to the body, finding the right treatment is going to be very difficult actually. And to find out what changes are happening in the body, we have to have a lot of more tissue available to us actually. And there is a lack of available tissue of patients that are affected with this COVID-19 to understand the pathophysiology of the disease. And once we have all this tissue together, we can study this tissue, we can understand the disease better. Then providing treatment is going to be a much easier process than trying. And right now we are just like taking any drug that we think will work and using it so that we can find some urgent cure to it. But the only way to find a real cure will be to understand the disease in a much better way.
So what is the biggest challenge, or what are our biggest challenges in finding a cure for COVID-19?
So I think the biggest challenge right now is we have to first understand the pathophysiology, like what is the virus doing. So to understand the pathophysiology, what do clinicians do basically? They will look at biopsies from the lung and from other organs that are affected. They will look at radiology images and then try to see where is the damage and what kind of damage is the doing actually. And what are the antibodies that are produced in the body? How are they fighting the virus? For this, we need a lot of information from patients from around the world. And the stumbling block that I've seen is there's a lot of autopsies that are being done around the world, and all the studies that are being done with very small number of cases. So if you really want to understand the disease, we need to collect all these cases from around the world, almost have like a repository of all these cases, and then provide all these cases to the researchers so that they have enough material to study the disease and then find the effective treatment for the disease.
And you hit it right on the head there. The issue is that siloed paradigm that we're all working individually. The US has cases in the US, Italy has cases in Italy, and so on. But everybody's working individually as opposed to collecting and aggregating all that information and working together.
Yeah, the power is in collaboration. Like if we can give people the way to collaborate, to share data, and then use those tools to like help each other out, we would move in a much faster way. And that is what I think every the world is trying to do. Microsoft is actually trying to do that in a big way, and we are also using Microsoft resources to do that to do the same thing actually.
Great. So how is PathPresenter helping the public in finding a cure for COVID-19?
So I'll explain what PathPresenter basic functionality is. Basically, what it does, it allows people to upload medical data from all over the world into the Microsoft Azure cloud. And
Individuals can upload that, or doctors? Who uploads it?
Mostly it is any individual can upload it, but it is usually the physicians and the pathologist and the radiologist that can upload the medical data, like if they have if they're doing an autopsy, or if they have a patient from which they have had a biopsy. So the pathology data that is available from that patient, or if the patient has undergone a radiology test and he has an X-ray or a CT scan, all those are very special kind of images. So they are not like just a JPEG image that is 1 megabyte. So the medical images that we are talking about, the pathology whole slide images and the radiology DICOM images, they vary in size from almost like 150 MB to 5 gigabytes. So these are huge images, and like to upload these images, you need very powerful networks. And what PathPresenter is providing along Microsoft is a very easy process to upload these images into a single data repository that can then be used for a collaborative effort to research, for educating the physicians around the world and find the right treatment actually.
So talking about how you leverage Azure, PathPresenter recently launched a new offering on the Microsoft Azure Marketplace called PathPresenter Education. Tell us about how it addresses some of the challenges we just discussed.
Yeah, so like radiology was digital from almost 10 years ago. So people were very used to looking at radiology on the computer, and the X-ray films that we saw in movies have gone away a long time ago actually. Pathology was still very, like for the last 150 years, pathology was still the same. Like people, if you go to a clinician, they will take a small tissue from your organ or from your skin or from your brain, and the tissue then goes to the laboratory. The laboratory will then process the tissue, put them on glass slides, and then just will look at them on glass slides on a microscope. The technology has evolved, and now you can convert this glass slide into a digital. And these digital slides, they are around 150 to 2 gigabytes in size actually. And to view these digital slides, you need specialized software. You just cannot open that image and see it on any computer actually. Because of the current crisis now, many more institutions are now moving to actually doing work digitally. So they are embracing digital pathology in a big way. But when they are embracing digital pathology, they have to buy a lot of technology. They have to buy the scanners that will convert the digital slide into the glass slide into a digital slide. They have to buy storage. They have to buy the infrastructure. And this is almost like more than $1 million in investment. So all the institutions are undergoing this process where they're in millions of dollars to move to digital pathology given the current situation. Now, when an institution makes an investment of millions of dollars into converting into a digital format, and if they can only look at the slide and provide a diagnosis, then their entire investment goes to waste actually. It doesn't go to waste, but it doesn't give them enough returns from that investment. So that is PathPresenter comes in now. So once you have put in your infrastructure, you already are producing the digital slide and you're making a diagnosis. Now you can actually use PathPresenter to use those slides for providing education, for doing your conferences, for doing your tumor boards, because every hospital does multiple tumor boards every week. And what a tumor board does is they will provide the clinician, the pathologist, the radiologist, they all come together in a room and they discuss all these cases. So the pathologist will talk about the pathology, the radiologist will talk about the radiology changes, and the clinician will then talk about the clinical changes, and they will all try to come to a consensus as to what is the best treatment. And now PathPresenter allows this to happen online actually. So you can do the conferences online, you can do all these meetings online, because it provides them the tool to combine all these digital slides, radiology images into very slick presentations, conference modules, sharing of this images very easily across the world. So and all this is now very easy on PathPresenter. So that is the reason people really love to use PathPresenter, because now they have the digital slide and they can use the digital slide multiple ways to enhance not only patient care, but also their education and research capabilities.
And how would a healthcare provider use your solution with Azure?
So the healthcare provider can use the solution in multiple ways. So let's say, I'll talk about my own use, because I'm a healthcare provider. I work at a big academic center, which is not only very big in patient care. There's a lot of education. We have one of the biggest medical schools and the research centers and resident training programs in the world. And also we are one of the biggest organization that does a lot of research actually. So any organ like MD Anderson or Sloan Kettering or Harvard or Sinai, how are they currently using PathPresenter? All of them are using PathPresenter in a different formats actually. So once they are using it for doing their conferences. So right now you cannot get all the trainees into one room, because there's a lot of social distancing. But the training still has to continue. You cannot stop the training basically. And PathPresenter provides an ideal platform for training to be done on the cloud. Uh, if somebody let's say there's a pathologist sitting in Japan or Australia, and they want to show a case to somebody at Sloan Kettering, because the expert is sitting at Sloan, or he's sitting at MD Anderson. They can do that using PathPresenter in a minute actually. So they could actually upload a case into PathPresenter and immediately send a text, a message through presenter to a pathologist sitting in New York, that we are sending you a case, can you look at it basically. And all this can happen in the course of 10 minutes actually. Like the pathologist would be able to see the slide, would be able to call the person up and talk to the person on PathPresenter and give a second opinion. uh, the for every healthcare individual, they have to also go to conferences every year to keep their licenses active. So for me to keep my license active, I have to go to conferences, attend seminars, and collect around 50 CME credits. That I've gone there, I've attended these education conferences and learned what is happening about my specialty, what is new in my specialty. So that can all now done online using PathPresenter, because there is a conference module on PathPresenter where institutions can provide conferences, they can provide the CME certification. So what happens is the institution can now have revenues that the physicians will pay. Every physician pays almost like $5,000 every year to get the CMEs actually. So this revenue now goes to the institution that is holding these CME activities on PathPresenter. So there is a way for the institution to make money, and then for the individual physician, they can just sit in their offices and they get that 50 CMEs to keep the licenses active actually. So they don't have to travel to Orlando or San Diego to go to these meetings. So they are saving on time, they are saving on all this wasted travel time and money, and they're getting their CMEs sitting on their offices or at home using PathPresenter.
Wow, incredible. So, Rajendra, how can customers find out more about PathPresenter Education and procure it through the Azure Marketplace?
So the easiest way to find PathPresenter is you go to the marketplace and you can look at, if you just go into the Microsoft Azure Marketplace and you type in PathPresenter, it will actually link you to the PathPresenter logo. From there you can there's a button that says Get PathPresenter, and once you click on that, then it will link you to the main site actually. And the URL for the main site currently is pathpresenter.net. So www.pathpresenter.net, where you can just immediately go to the system and actually also try it out as a free trial basically.
Excellent. Rajendra, how has partnering with Microsoft helped PathPresenter scale and grow your business?
So that has been the beauty of the whole thing. Like Microsoft has been a very spectacular partner from day one. They have in their, it is I think because of Microsoft that we have been so successful, because now we are being used in 168 countries. We have 125,000 plus users. So like the total number of users has crossed almost like 125,000 from around the world. And then we have multiple institutions and organizations like the WHO, the Digital Pathology Association, the International Association of Cytology. All of these are actually using PathPresenter. And why is it successful? Because we are using the Microsoft Azure cloud. And Microsoft has not only provided us a lot of technological support in building the infrastructure so that institutions and organizations can connect with the Microsoft Azure cloud. They have also provided a lot of people like help in the form of technical help. There are multiple people that will come online and help us whenever we are stuck on something. They have provided us with credits. So lot of support from Microsoft, and that is what has made PathPresenter very successful. Currently, actually, if you look at the amount of data that we have on PathPresenter, it is the largest open public library on the cloud.
Awesome. How can people find out more about Microsoft partnership opportunities for healthcare partners?
So for more information, they will have to send an email to healthcare. It's healthcare and then INDEXP at Microsoft.com. So healthcare INDEXP at Microsoft.com.
Awesome. And how do people connect with you?
At LinkedIn, you can either go through, there's a PathPresenter page. You can also find me on LinkedIn. So Rajendra Singh. On Twitter, we have at PathPresenter. And then my Twitter handle is at mypath, MYDERMPATH, or you could go at PathPresenter, and both of them are going to bring you to the PathPresenter.
Great. And I'll post that to the show notes so people can just pull that up and get right to you.
That'll be great.
Rajendra, do you have any parting words of wisdom that you'd like to share with the audience?
Yeah, so like the world is now currently like there's a massive shift going on towards the digital world. There is no doubt about that things are moving to the cloud or they are moving online. Everything is moving online. And as academicians and clinicians, like as we are academicians first and clinicians first, and everything is centered patients. So we have to make sure that the current and the next generation of doctors that are coming in, they are well trained and they understand how to apply all this changing technology to help treat the patients in a better actually. And for that, we need to embrace this new world ourselves first and make ourselves adapt using all this technology that is now available to us actually. If we can adapt and use it ourselves and then train our current doctors and the doctors that will come in future to use all these technological tools, they will be able to better treat the patients, to educate the next generation of doctors, and also use it in all the research basically. So my appeal would be like, let's get together, use all the technology that is available, and build all these work on all these collaborative platforms through wonderful partnership through Microsoft Azure cloud, and do something that will help patient in the long term basically. Because everything should be centered around the patient.
Absolutely. Rajendra, thank you so much for sharing your time and your wisdom. I really enjoyed having you on the show.
Thank you very much for the opportunity.